Namaskar. PCOS or PCOD, which is also called polycystic ovarian disease or syndrome, is a common condition seen in the young girls, especially from the age group of 16 years to 45 years, more in younger generation. And this disease has become extremely common these days, I think much more than what it used to be 20, 30, 50 years ago. There are multiple reasons. Apparently, the reasons could be lifestyle changes, stress factors, diet, consumption of certain medicines, hormonal based products, milk products, dairy products, junk food, and so on and so forth, etc. And as a result, you find that the young girls come with the symptoms of PCOD in terms of dysmenorrhea, menstrual pain during menses, excessive hair growth, hirsutism on the face, on the upper lips, etc. They put on weight, they may have hair loss, they may have mood swings and menstrual irregularities in terms of late menses, irregular menses, delayed menses, painful menses, heavy bleeding, and so on and so forth in different combinations. Typically, conventionally, the gynecologist might like to treat this condition with certain hormones, and they may help you induce the menses. But the problem here is that once you induce menses using the hormones for say 3 or 4 months, after that, if you stop the medicine, then the patient may not get menses for maybe 2 months, 3 months, or longer. So there is a drug dependency that gets developed. So then we need an alternative. So what is the alternative? I would say homeopathy has a treatment to offer for the cases of PCOS or PCOD. It has been clinically observed in our practice as well as in the practice of thousands of homeopathic practitioners that PCOD responds reasonably well to homeopathy. Homeopathically, when we treat the patients, we observe that the patient's symptoms they get better. Many of the patients they start showing regularity of the menses. The symptoms of pain, discomfort, heavy breathing, etc. they respond quite well and the patients show improvement. Excessive hair growth or hirsutism, whatever hair growth the patient may have, that will not go with homeopathic medicines. That may require some laser or some other kind of therapy. Patients who approach us with a fresh diagnosis of PCOD, they respond much better as compared to those patients who might have PCOD for say 5 years or 10 years and they may have been consuming hormonal treatment to induce the menses. And then such cases are difficult, and once you reduce or stop using the hormones to induce the medicine, then the patient may not get menses for 2 to 3 or 4 or 5 months. This is the common observation. And that time could be a little tricky. It has to be well managed. PCOD leading to infertility is another challenge in the age group of around 25 years onwards. And then the focus is on how to make the patient conceive while treating the PCOD or PCOS. So the treatment and approach differs in different age groups depending on what is the purpose of treating PCOS. If the patient doesn't have many symptoms of PCOS at the age of say 16, 17, 18 or 19, 20 years of age, then probably in my opinion, she may not require treatment. If the symptoms are very severe, irregularity of menses, heavy bleeding and painfulness, then only the treatment should be required. And I would say homeopathy is a safe and effective option in the treatment of PCOD or PCOS most of the time. Only some cases which may not respond to homeopathy, and the patient may not get menses for 8 to 10 months or longer, then maybe some hormonal intervention may be required. One may have to investigate the patients of PCOD periodically by not only the sonography every time, but also other hormonal assays must be done to evaluate the role of other hormones in the development of PCOS. Besides the medication, one has to also make sure that certain dietary changes are done. The patient should avoid using dairy products, junk food, gluten if possible, and also must go for physical exercise, fitness program, because this all play a role in the maintenance and the development of PCOD. So everything has to be looked at in totality to control this disease, because this is a generalized condition. This is a systemic disease, so to say, which has influence in many parts of the body. So it has to be treated in totality. I hope this video will help. Thank you for watching.